Hi, everyone. Great to see you all. This is much different than how we usually meet, and hopefully we'll be back together soon. Excited to talk with you all today about what is taking place at UCHealth Training Center today. We're providing a voluntary vaccination opportunity to our full-time and part-time staff, both at Empower Field at Mile High, as well as UCHealth Training Center. We have also extended this offer to players, coaches, cheerleaders, our alumni, and their family and friends. This wouldn't be possible without the partnership and support of UCHealth, as well as the state. We're grateful for them and all of the work that they provided to make this possible. I also want to thank our infectious control officers, Nancy Sabota and Steve Antonopoulos. They have set the standards for the Broncos organization when it comes to COVID policy, and they've helped keep our building and our staff and our organization safe. We will be administering the Pfizer vaccine. This is a 2-shot vaccine. Our second shot will be May 13th. We've already had a number of players, Tier 1 and Tier 2 staff come through. We have a physician on site provided by UCHealth that is overseeing the process and ensuring that it's safe and comfortable. And we're looking forward in the next couple of hours to welcoming additional staff as well as their families. Now I want to introduce you to Dr. Michelle Barron of UCHealth. She has been a guiding light for us as we have set our COVID policy. We have been speaking with her over a year about COVID-19. And over the last week, she's joined the organization twice and spoken to over 220 individuals about the vaccines, about their efficacy and their safety. In order to really return to normal, to get back to football, the Broncos are going to do their part to ensure that we're spreading the message. And that's why I'm so excited to introduce you all to Michelle. Dr. Barron, go ahead.
Great. This is so exciting. I can't tell you how excited I was when I heard the Broncos were going to be participating in this. Getting a vaccine is so important right now. We are seeing cases starting to rise. We're hoping we're in this race right now where we need to combat the COVID spread by getting vaccine, and having the Broncos do this is just amazing. I'm so excited for everyone here today that is getting access to the vaccine. This vaccine still is probably the most exciting thing that we've seen in modern medicine in years, decades, because of how safe it is, how well it works, and the opportunity to do this today and be part of this great team, both the Broncos and to protect the community, is just amazing. So very excited to be here.
Great, we'll start with Brandon Cristal. Why don't you lead us off with some questions, please?
Yeah, I guess the question's for both of you, maybe more specifically for Brittany, though. You said you started talking to Dr. Barron a year ago. How big of an undertaking is this? Because you talk to anybody, they'll tell you how hard it is just for one person to find a vaccine, and you're kind of playing roulette with, websites and stuff. So to get your hands on 400 doses and will all 400 be used, or how close to, using all of them will y'all be today?
So a year ago, we weren't talking about vaccines. We were talking about how to keep this organization safe and to keep our community safe and what policies we can put in place, from PPE, social distancing, restrictions on capacities, how to sanitize things. That's really what we were talking about a year ago. But, about December, I started scenario planning, considering when vaccines would be made available to the public. And I've been very in close contact with the governor's office, as well as CP, Colorado Department of Public Health and Environment. And, just having those conversations, understanding what that might look like in the future, and just helping them partner to get the message out about how we all need to get the shot, but also ensuring that we're providing that for our organization and ensuring that the community that's directly related to the Broncos is safe.
Next one, George Doyle.
This is for both of you guys, but I think more for Dr. Barron. I think you spoke to quite a few players and staff members last week when you guys announced this about educating people about the vaccine. Have you had any conversations with players or staff members about why they should? And have there been anybody that maybe has come forward that was maybe on the fence about getting the vaccine? And I guess what did you tell them, or what advice did you give them?
So in addition to the organizational meeting that we had to discuss the safety about the vaccine, as well as some of the logistics, we had another meeting with the players themselves, and they asked some really great questions. And from my understanding, some of them were persuaded by that, but I have not had any individual conversations specific to the vaccine. Mostly, again, it's making sure that people have the right information. And I think that's been the key with this, is that people understand the vaccine is safe. It's very efficacious. There can be side effects, but most of those can be mitigated with Tylenol and ibuprofen within a few days. And at the end of the day, not getting COVID, not getting hospitalized, and not having people die is our primary goal. We want to end the pandemic, and we want to keep people safe. So luckily, some of that information, I think, was helpful to people to be able to make those choices.
Next one, Jeff Leggold, ESPN.
This is for Brittany, and then I have a follow for Dr. Barron, then please. Brittany, just can you sort of frame the strength of your get the vaccine message? I mean, how strongly have you presented this? Because, I mean, we are seeing more and more sort of stories about hesitancy and a decline in vaccinations nationwide, but how strong were you in the message? I mean, I know you can't say we require you to get the vaccine, but how did you present it?
I think that it's exactly what Michelle said. We are providing the information and the transparent information and the statistics in order for you to make a decision for yourself and your family. We believe that the safest option for this community is to get the shot. And I believe the league is also sending that message by requiring tier 1 and tier 2 staff who closely interact with the team to be vaccinated unless they have a religious or medical reason. So I would say it's a strong message, but it's respectful of other people's choices.
And then Dr. Barron, I'm just curious, when people do ask you about the vaccine and potential side effects, what are some of the biggest topics they want to cover there? What are their biggest concerns?
I think the biggest concerns that they've had are obviously side effects. You have groups of people that are highly in tune with their bodies, and they just kind of want to anticipate what they're going to feel or what they might not feel. And there's been such a variability in terms of how people react to the vaccine or don't. And I think just general questions still about, about the manufacturing process, how they were made and how we've tested them. I think millions of people have now received this vaccine. There's obviously a lot of people looking at the safety of this. I think the fact that J&J was temporarily paused is a testament to how often people are looking. 6 people out of 6.6 million shots is what triggered this pause. That statistically is so low. That tells you, again, the fact that they have not seen it with the other vaccines wasn't a function of them not looking. It just hasn't occurred. And I think that gives individuals some reassurance that this is the right thing to do. And again, at the end of the day, we all want to get back to our lives. We want to see football live. We want to be able to cheer on our sports and be with our families and friends without having to always think about things. So I think we're getting closer by doing this today.
Do you have like your neighbors even questioned you about the vaccine? Just people you meet, outside of this world?
Absolutely. Even within my family, I have to say that even though it's my specialty and you'd think that I'd have some deference, I am still their daughter, cousin, sister, etc. And so they had questions. Nobody was actually outright against it, but they definitely had questions. And so far, all my family members and friends that have had some concerns, we've all sort of worked through it and they're getting their vaccine. And some of it, even not just for them, it's really because of family members that are older and just wanting our lives to be somewhat more normal and understanding that it's going to take all of us to do this. This is a team sport as well, where we all have to coordinate together.
Thank you.
Next one, Eric DeLala, DenverBroncos.com.
Yeah, thanks both of you for doing this. Brittany, you spoke a little bit about what the last year has been like. Looking forward, what are your expectations about how this vaccine event and other efforts could impact the ability to have a full stadium this fall? And I guess just what's the feasibility of that in your eyes, and Dr. Barron, yours as well?
That's something that we're discussing often. As Commissioner Goodell said this past month, that the NFL is looking to have 100% capacity in their stadiums, but that requires us all to take the safety precautions that are necessary. And we'll be prepared to do that with the help of medical experts like Dr. Barron advising us on how to safely reopen our building to fans and season ticket holders.
And I would concur with that. Obviously, we're going to have to look at all the scenarios at the time. We can't predict. This virus has been somewhat unpredictable in terms of the highs and lows that we've seen over the last year. And safety is obviously paramount. And we'd want to be able to make sure that that was in the background and we follow all the protocols necessary so that people can then just watch the game and not have to worry about thinking about other things.
Next, we got Ryan Miller, Denver Post.
Hey there, one for each of you. Start with Dr. Barron. Two parts. How many coaches and players have gotten the first shot today?
I actually don't know that specific answer. I apologize. I'm sure somebody can get information for you, but I don't know that off the top of my head. People are filtering in throughout the day.
Okay, as a follow-up, are you and UCHealth working with Avs, Nuggets, Rockies, Rapids for the same kind of program?
We have been working with several of these organizations to ensure that they have access, and also, again, with the same intent of that this is just one more step to the community getting vaccinated and this pandemic ending.
Gotcha. And then for Brittany, about a year ago, Joe Ellis gave you this project. What's been the biggest challenge as you've had to meet new people and come up with these protocols, et cetera?
Great question, Ryan. Thank you. First, I'll say that we're vaccinating just over 150 individuals. So that will give you a sense of the players and coaches question that you asked. I wouldn't present this as a challenge. It was an opportunity for me to really lead in the organization. And it allowed me to get to know really everyone, because this required entire processes to change. For us to rethink how we have been doing events, how we have been running training camps, how we eat in a cafeteria. And so it allowed me to work with so many colleagues, and that was really incredible, and something that I don't know if I would have had the opportunity to do if COVID hadn't come to fruition. Unfortunately, it did, but it gave me a real opportunity to lead with my colleagues. And I think that we have created an incredibly safe environment here at UCHealth Training Center, as well as in Power Field. And the teamwork that went into developing those policies and keeping fans in our organization safe give me so much encouragement for my next opportunity in the future. And I'm really looking forward to working with my colleagues on that.
Thank you.
Next one, Mike Kliss, 9 News.
Yeah, Brittany, you said before that you would like to, one day replace sit in your father's chair as the controlling owner of the team. How do you think this COVID endeavor that you've been in over the last year has helped you move toward that ultimate goal?
Today we're really here to talk about vaccines, but it's no secret to any of you that this is my dream job. I want to have a career in football, and I'm going to do everything to make that possible. And COVID has opened many doors for me to allow me to continue to have that career, have those opportunities, and really champion my colleagues and work with them. They have been incredibly supportive, and I'm looking forward to continuing on this journey together, and I'm hopeful for the future.
And then also, Dr. Barron, in getting the vaccine shot, they kind of warn you that, especially after the second shot, that you can be sick for 24 hours. Has that been a deterrent? Players kind of have to invest in this knowing that they might lose a day of their lives being sick.
Yeah, and so the way I sort of approach that question, because it certainly comes up, because it's not inconsequential to lose a day of your life. Getting COVID is far worse. Getting COVID can have long-term effects, even if you're young and healthy. Some people continue to have fatigue, have headaches, have memory loss. So it's not a walk in the park. Certainly people get COVID, get hospitalized and die. And so that's often what I sort of say, okay, one day without having a workout, one day maybe having to be a couch potato versus however many days in the hospital, however many days with not being able to do what you want to do because you don't feel well, or the potential for dying. I think for a lot of people that ends up being a very easy choice.
Guys, we got time for few more. Next one, Zach Stevens with DNVR.
Dr. Barron and Brittany, thanks for talking with us today. Brittany, when did you get this this idea to create this vaccination event today, and why was now the right time to put it on?
I think that, it really started with our infectious control officers and I having some conversations. So Steve Antonopoulos and Nancy Savoda just talking about, how do we reopen the building safely, and understanding that requires us to consider opportunities around vaccinations. And that was probably a couple of months ago. And then we just really did the research, understood where the supply was coming from and when it was going to open up to the general population, and ensuring that we were aligned with that timeline with the state and the governor's office, and just having those kind of conversations and partnership in order to be able to have this opportunity.
And a follow-up for both of you on that. How important is it for players and people in the organization to get the shot, not just for their own well-being, but for also to show the community that it's something that they should do?
Yeah, so obviously I think we were talking before this about sports is one of the few things that people can either agree or disagree upon, and very passionately so. And so I think having the Broncos do this is amazing. And again, hopefully we'll show others that, yeah, the Broncos are doing it. We all get behind the Broncos and we can do it with them as well. And having that impact on the community at large is so important.
Yeah, and I'll add to that, Zach, football is family and we care about our community, and this is an incredible platform, and we have to consider how we use this platform to keep our community safe. That's a great responsibility that we have, and we take it very seriously.
Final three, Brandon, Eric, and Ryan. Go ahead, Brandon.
Brittany, I guess two for you, but so I'll re-ask. Do you know how many of those 400 doses you think will end up getting used? I know you can't really predict the future, but do you think, based on feedback and opening up to alumni and former players and their families, that almost all those doses will get used today?
Not all doses will get used today. The rest will get used on May 13th. So the way that, and Dr. Barron can probably talk about this, but they'll remain frozen for us, and we will utilize them in our second vaccination day.
And then kind of back to, I know players is a whole separate thing because of the CBA, but with every other team employee, if they don't have a religious objection or a health objection, can you require, I know maybe require is not the right word, but if you have 95% of one department and they're all vaccinated and one person just chose not to, do they end up having to work from home? Or is there a work requirement without legally requiring it? I know it's kind of a tricky thing and I don't want to get you in trouble with the lawyers, but.
No, it's a good question. So the league has required that tier 1 and tier 2 individuals get vaccinated. Those individuals are in close contact with each other and team. Those are the only individuals in the organization that will be expected to be vaccinated unless they have a religious or a medical reason. If they do have a religious or medical reason, our HR department, as well as their department lead, will work with them to find appropriate accommodations so that they can do their job, and we'll make sure to take good care of them and keep them safe.
Next one, Eric Delala.
Yeah, Brittany, in addition to the COVID task force, you've also been involved with the team's DEI efforts, and just wondering, in light of yesterday's verdict, if you had any reaction, and just if you could reflect on the tangible progress the team has made in that area and the goals you still have moving forward.
first and foremost, I think our thoughts and feelings are with George Floyd's family, and that we hope that they find healing in this moment. Yesterday's verdict, I don't think it was justice, it was accountability, and there's a lot more work to be done. And I have to recognize the players for the work that they have done with the organization to be part of that conversation. And there's still a lot of work to be done. I spoke to 400 students during our DE&I huddle, I believe earlier this week, but maybe that was last week. Who knows? And I said that we're never going to be done. This is going to be always moving, and we're always going to have to progress in our efforts. And one thing I'm excited to share is we'll be hiring a VP of Diversity, Equity, and Inclusion, and we'll be sharing that with the public in the near future. And we're looking forward to having them come aboard.
Final one, Rhino Heller.
Hey, Brittany, next week you guys are going to add draft picks followed by undrafted free agents. Have you guys discussed a schedule to offer them a Pfizer shot once they get here for rookie camp?
Those are things that we are actively in discussions with. Ryan, you could be doing scenario planning with me. That would be great. We will look to find the ability to provide vaccines to, new players that are joining the team and just new organization members as well. And to do that, we'll, of course, continue to partner with the state as well as UCHealth.